New tonight, 12 News Investigates goes in depth looking into the testing dilemma facing Texas.
There are sites running at capacity and appointment times fill up fast, but you can still get a test. Anastasia Bolton and Erica Proffer investigate how.
Let me see.
When Giovanna De Leon tried to save a spot in line for a COVID-19 test.
If you are calling to schedule an appointment, please press 1.
De Leon waited an hour 22 minutes on the state COVID-19 testing phone line, hoping to reserve a spot in Hayes County near Austin, but couldn't.
It was just show up tomorrow between 8 and 5.
Am I able to pre-register?
No, ma'am, not with this site.
Same rule for this community care clinic in Austin, where workers say the facility runs out of tests within the first hour of opening.
Rate of increase is increasing very rapidly, and it's going to be hard for us to keep up with testing.
Austin's Public Health Interim Director, Dr. Mark Escott, told City Council members they need to shift their testing strategy. Only test people with symptoms.
We simply do not have the capacity to provide those tests and ensure adequate turnaround times for those who are at the highest risk for being positive. This is every jurisdiction in the state of Texas.
We do have a lot of worried well out there right now that are going and getting into testing lines and lanes that are backing it up for those that might really need a test.
Nim Kidd is the chief of the Texas Division of Emergency Management.
One of the things that we learned is it's very easy for the state of Texas to put a bunch of tests out there. But when our private sector lab partners can't keep up, then we have longer times.
TDEM is responsible for 32 of the 957 test sites across the state. The number of total sites is constantly growing.
That we need to be testing those that are symptomatic or those that have been in contact with somebody that's either been laboratory confirmed positive or is symptomatic.
There are daily limits on how many tests a county, a city, or a site can do.
People have asked, why can't we do more at each site? And we may get to the point where we're doing more at each site. But Anastasia, the most limiting factor in this is the lab capacity. It's the laboratory capacity of where they're going.
Kidd says the state has come a long way from a few dozen test results each day to 52,000 recorded Monday. Harris County has been maxing out on testing every day for several weeks.
So we're continuing to look at ways that we can increase capacity. I think this is part of a larger effort across the system to try to get testing to as many people in the community as possible.
The state's interactive map will show you the nearest testing site, tell you when it's open, and what's required to get tested. You can also call 211. When do you get results? Depends on the lab that's doing the testing. It can be anywhere from 2 to 7 days. Officials say part of the answer to the recurring capacity issue is us, what we do and how we behave.
Wear your face covering, try to maintain physical distance. It does not work and we cannot flatten this curve. Everyone must do their part.
With Erica Proffer, I'm Anastasia Bolton.